In this video, I want to talk about eicosanoids, which are 20-carbon fatty acids, and their role in signaling during inflammation. And it all starts up at the phospholipid bilayer. So in the phospholipid bilayer, we have our outer leaflet and our inner leaflet. We have the hydrophilic phosphates with their negative charges and the hydrophilic fatty acid chains sequestered in the middle. In this cell membrane, we actually have a lipid embedded here called phospholipase A2. And what it does is it'll cleave a 20-carbon portion, an eicosanoid portion, off this fatty acid tail, and that's called arachidonic acid, and this is a pro-inflammatory precursor molecule. So once it becomes arachidonic acid, it can be acted on by different enzymes and go different ways. So one way it can go is if cyclooxygenase enzyme, COX enzyme works on it, it'll go towards prostaglandins. If there's an enzyme called 5-lipoxygenase, it will go from arachidonic acid to leukotrienes. Now, prostaglandins, the name comes from where they originally found this molecule in the prostate gland, but it has a big role in inflammation as well. And then leukotrienes, if they originally found this molecule in leukocytes or white blood cells, and the trienes is just talking about its chemical structure. It has 3 double bonds between the carbons. So prostaglandins, there's a couple different isoenzymes, one being COX-1, cyclooxygenase 1. It can act on, arachidonic acid. It kind of go one way. There's different prostaglandins, so it kind of takes it away of one collection of prostaglandins. And if COX-2 acts on it, it'll go this other way. And then, so let's go ahead and talk about this first, and then we'll move over to this side. So whether it goes the COX-1 or COX-2 way, it's going to increase pain, increase inflammation, and increase fever. So it doesn't matter which way it goes, COX-1 or 2, it's going to have that effect. But there's some unique sides to the COX-1 side. So it can increase platelet aggregation. So there's a prostaglandin, it has a specific name called thromboxane A2. And it's called thromboxane because this prostaglandin was found in a thrombocyte or a platelet. And this one stimulates platelet aggregation. So if COX-1 acts on arachidonic acid, it'll increase platelet aggregation, so it increases blood clotting. This side also increases the GIT integrity, the gastrointestinal tract integrity. So whenever COX-1 acts on a prostaglandin in the stomach, it'll increase mucus production and improve the barrier of our stomach from the hydrochloric acid. So that's on the COX-1 side. The COX-2 side, there's a specific prostaglandin called prostacyclin, and it's actually secreted by the cells, for the most part, that line our blood vessels, called endothelial cells. They'll secrete prostacyclin, and it decreases platelet aggregation. So if the COX-2 enzyme acts on arachidonic acid, it will decrease platelet aggregation, get you further away from a blood clot. So that's on the COX-2 side. And then it has a big role in the synovial fluid inflammation, or inflammation in our joints, our synovial joints. So this side, when COX-2 acts on arachidonic acid, can manifest in like rheumatoid arthritis and different types of arthritic disorders. So that being said, there's a class of drugs called non-steroidal anti-inflammatory drugs, NSAIDs, that work to block either COX-1 or COX-2 enzymes, or both. All of these will typically, to some extent, block both, but some are heavier on one or the other. They're more selective to either one or two. And aspirin is a great example of that. So aspirin is a drug that it'll block a little bit of COX-2, but it tends to block COX-1 more. So when it blocks COX-1, it has some effects. So one effect it has is it will decrease platelet aggregation because you're blocking the prostaglandin that increases platelet aggregation. So that's why people take an aspirin, baby aspirin today, 81 milligrams a lot of times, just to kind of keep those platelets a little more slippery where they're not aggregating, especially people that have a predisposition to like a heart attack or stroke. And then you have to take aspirin with food because it does block, to some extent, that gastrointestinal integrity aspect, prostaglandin, where there's less mucus production in the stomach, and you don't have, that can kind of cause stomach irritation. So that is all on that side, but it also affects pain and inflammation and fever, so it could decrease that as well. And then ibuprofen, like Advil, is kind of in the middle. It's a good equal balance of both, so it's not really going to tip the scale one way or the other as far as blood clotting or anything like that. And then we have a couple that are more specific to the COX-2 side, because patients that are having some type of arthritis, they need relief there. They need to decrease the inflammation there. And some of these drugs work selectively on COX-2. That would be like meloxicam or Mobic. That's one I see used a lot now with patients with joint pain. And it specifically works this side. And then another one is Celebrex, and its generic name is celecoxib, and it works on the COX-2 side as well. They pulled one called Vioxx off the market because if you think about, if you're specifically blocking the COX-2 side, then you're eliminating the effect of the decreased platelet aggregation. That kind of tips the scale more to platelet aggregation. And so they're finding that more people were having heart attacks that were on Vioxx, so they had to pull it from the market. And with meloxicam and Celebrex, they haven't seen that so much yet. So it's still used quite often. All right, so those are the non-steroidal anti-inflammatory drugs. Now, one thing I want to mention here is that Tylenol is a pain reliever, so it's analgesic. It's a fever reliever, so it's antipyretic, but it's not an anti-inflammatory. So we don't call acetaminophen or Tylenol a non-steroidal anti-inflammatory drug. It doesn't fall in that category. Now there's some contention that it blocks another isoenzyme called COX-3, but that's still kind of under investigation right now, so we're not going to go that far yet. So right now we're going to say it's not an NSAID. And then on this side, if 5-lipoxygenase enzyme works on arachidonic acid, it'll take that 20 carbon precursor and push it towards leukotrienes. And leukotrienes, what they do is they work primarily in the lungs to increase bronchoconstriction, so our airways decrease in size. We have smooth muscle that responds to those leukotrienes by contracting and causing that constriction there. It increases mucus production in the airways, so that's going to decrease the ventilation as well of getting air in and out. It also increases inflammation in general in the airways. So all of this kind of encompasses what we call asthma. So these medications are used a lot as far as asthma prevention, because you have your like albuterol if you're having an asthma attack, and that's a beta-2 agonist. But in this case, we're talking about leukotrienes, and there's some different drugs that work as kind of prevention in asthma to decrease the number of attacks. One is called Xylutin. Xylutin inhibits 5-LOX or 5-lipoxygenase, and then if you inhibit that enzyme, that arachidonic acid gets stuck here. It can't go to the leukotriene side. And so another drug called montelukast or Singulair, it's a leukotriene receptor antagonist, so it's going to block the leukotrienes from binding to their receptors. Maybe their receptors on the smooth muscle of the bronchioles. So those are leukotrienes. Now, we have drugs called glucocorticoids or steroids, like prednisone, hydrocortisone, dexamethasone, prednisolone, all these different steroid drugs. They also are anti-inflammatory. They have several different roles. They're really strong as far as anti-inflammatory drugs. But one role they have is they'll actually inhibit phospholipase A2 from cleaving that arachidonic acid to begin with, so it's just higher up, and it's going to help with decreasing the number of prostaglandins and leukotrienes from way up here at the top of this whole cascade. So that's the corticosteroids or glucocorticoids. They're called glucocorticoids because they also increase your blood glucose levels, and that could be a side effect of these drugs. Also, they work as transcription factors and decrease production of different cytokines and other inflammatory mediators. So they knock down inflammation so much that one side effect of steroid drugs is that you have more infections because you don't have the immune system protection that you normally do. So I hope this video helps you understand where NSAIDs work, where these drugs that work in the leukotriene pathway work, and where steroids work to decrease inflammation.